So the misinformation, unfortunately, have a higher speed, than the real information. And as we still register a lot of community death, it's meant for us that the community we need to work more to engage on the community. That for me, it is one of the biggest challenges. So far, a WHO only required of 115 million, and we only receive 49 million that has been mobilized. So that means we still have a big gap. I think together with Africa CDC, we are around 100 million, on the 518 million that is needed in order to support the operation in the field. So it could be really, I can say, where the international community really can be is supporting the financing of this outbreak to mobilize the funding so we can close that gap.
There are places where you have one community death in a new area, and in a few days you have 17 new cases. It's such a great example of how infectious anyone is that stays in the community as soon as they have symptoms. So if we don't have proper surveillance in place, if we're not able to monitor every single person that was in contact with a confirmed case, every single person that's at risk of developing the disease, if we're not able to monitor this, the outbreak will continue. The concern about people striking is serious. We see that certain staff are not paid. We see surveillance teams that were also not working. If we don't have staff working because they're not being paid, it means that work isn't being done. And there's a lot of work that needs to be here. There's 6 pillars to outbreak response. Every single pillar needs to be in place to be able to respond to an outbreak. So if you have some teams, like surveillance teams, not working, it means that you're not going to be able to stop an outbreak. And so this is a real concern. But people arrive very, very late, either because it takes a long time for them to get to where we are, or because it took a long time for them to be diagnosed with actual illness. And so this is challenging for our teams because we know that we can have people arrive earlier. We know that there can be a better situation, but people arrive. We have many, many patients arriving that are already unconscious, and then they die quite early after they arrive.
Ili tutambue kwa njia ya msalaba huu mateso na